Hello, my name is Dr. Jeff Harris. I'm a counseling psychologist in New Mexico in the southwestern part of the United States. I'm going to be sharing with you lesson one of key strategies training for psychotherapy students, building a bridge between basic micro skills and evidence-based practice. This is a method of training that I developed with three colleagues, Leslie Kelly, Elizabeth Campbell, and Aaron Hammond in 2011 at Texas Women's University. And this is a slightly revised edition of that, but it's essentially the ideas I developed with Leslie, Elizabeth, and Aaron. So let me tell you a little bit about key strategies training. This is a method for training new psychotherapists, although it's also experienced psychotherapists could use it to balance out some of their skills. It represents an introduction to the idea of psychotherapy integration, and we'll be talking about that a little more. This method introduces graduate students to intervention strategies from research-supported treatments, and it builds on basic micro skills. So you may have already had a class where you learned basic counseling skills like attending, observation, questioning, paraphrasing, summarizing, and reflecting feelings. And this training method we're going to be talking about today teaches a method for making intentional choices about where to focus. And that's always an important question in psychotherapy, is that do we focus using our favorite theory, or do we always use the same? Do we always focus on the same dimensions, or is there a specific method for that? So we're going to be, key strategies training will include a method for choosing where to focus. We're going to be drawing skills, key strategies from three foundational theories. First of all, Aaron Beck's cognitive therapy. Second is Leslie Greenberg's emotion-focused therapy, which is an integration of person-centered therapy and Gestalt therapy. And then Martel's behavioral activation, which is a form of behavioral therapy based on operant conditioning. So this is our lesson plan. Here we are in lesson one, parallel strategies for cognitive change. Then we're going to spend 2 weeks on 2 lessons on exploring thoughts and changing thoughts using cognitive strategies. Then we're going to spend lessons 4 and 5 are going to be using strategies from emotion-focused therapy, first for exploring and then changing emotions or feelings. Lessons 6 and 7 will focus on actions and use behavioral strategies that explore and change actions. And then the last lesson, lesson 8, is going to be about using a multidimensional survey to choose a focal dimension. So once you've learned a little bit how to explore and promote cognitive change, when you've learned how to explore and transform emotions or feelings, when you've learned how to change actions, explore and change actions, then the next step in lesson 8 is to look at all 3 of those and work with a client in collaborative dialogue to decide where to start. So should you focus on changing thoughts first? Should you focus on changing emotions or feelings, or should you change behaviors first? So that's the final part, is once we know how to travel down these 3 roads, it's a method to choose which road to start on. So this is lesson 1, parallel strategies for exploration and change, where we're going to be looking at 2 different phases of treatment. First, the exploration phase, and second, the change or transformation phase. And we'll talk about those phases in a few minutes. So we said that key strategies training builds a bridge between basic micro skills and evidence-based practice. So many graduate programs start with learning basic interviewing skills using a text like Alan Ivy's book, Clara Hale's books, or Gerard Egan's books. And after that, we're going to add on to that 24 key strategies drawn from empirically supported treatments, specifically behavior therapy, emotion-focused therapy, or behavioral activation. So the idea here is that this prepares you as a student to implement evidence-based practice in a structured yet flexible manner. So we're going to provide some structure, and some flexibility. And the multidimensional survey in lesson 8 will give you that flexible choice. So I want to talk a little bit about the relationship between basic interviewing skills and psychotherapy theories. So new trainees often perceive a gap between basic interviewing skills and more complex psychotherapy theories. And what we're going to try and do in this training module is to build a bridge where you start with the basic interviewing skills of attending and asking open questions and paraphrasing and summarizing. And then building on that foundation, we're going to have 8 strategies from each of these 3 complementary psychotherapy theories. So this picture illustrates the way that what psychotherapy theories and basic interviewing doing skills do. So up top, we have we're suggesting that psychotherapy theories can contribute to both conceptualization and interventions. And in this view, conceptualization is how we think about clients. And so looking at these 3 theories, we're going to be, the conceptualization are, is this way of thinking functional or dysfunctional? Are these emotions adaptive or maladaptive? Are these behaviors effective or ineffective? And so that's the way we're conceptualizing. But the psychotherapy theories also give us some interventions, and that's going to be the focus of the next 6 lessons, is learning some of these interventions. So the conceptualization has the little thought bubble because that's what you're usually thinking about, but the interventions has a dialogue bubble because interventions are things, for the most part, that counselors say or do, and mostly verbal behavior, asking questions, paraphrasing, summarizing. So on the bottom line are the basic interviewing skills, and we're suggesting that those lead to common factors. And common factors are the elements that all psychotherapy theories hold together. So basic interviewing skills support common factors like the therapeutic relationship and an expectation for positive change. So most theories are based on having a strong therapeutic alliance and trying to create the idea in a client's mind that they're going to change. So in this way, Key Strategies Training provides a method for choosing which theories and strategies may be most useful for a particular client. So instead of saying, I am a cognitive therapist, I will always use cognition as a lever for change, the lesson 8, where we do the multidimensional survey, that's a way to work directly with the client using collaborative dialogue in order to make an intentional choice where to focus based on the client's needs rather than based on your own theoretical preferences. And we'll talk about your preferences. We all have preferences, but it may be doing a multidimensional survey is a way to tap into the client's preferences to decide where to focus. So we mentioned the idea of psychotherapy integration. So in the past, psychotherapists and counselors were encouraged to select one theory and to practice it consistently. I'm a cognitive therapist. I'm a psychodynamic therapist. I am a Gestalt therapist. But more recently, integrationists have encouraged counselors to acquire a wider repertoire of skills and to select interventions based on the needs of the individual clients. So that's what we're saying about collaborative dialogue, that we're going to talk to clients and help them, and we're going to make choices based on their needs rather than our theoretical preferences. So it's challenging to balance the need for a solid foundation of knowledge and the desire to develop a wide repertoire of skills. So that's one of the arguments against integration, is that if you have lots of skills, you may not have a foundation. And so what we're trying to do here with Key Strategies Training, with KST, as we call it, is to give you a foundation in 3 theories. And we're going to be presenting them in parallel strategies, parallel structure, so that it's easier to integrate them. So this is one foundation, looking at the interaction between thoughts, feelings, and actions. That's more complex than a single theory, but isn't too overwhelmingly complex, we hope. So key strategies is a method for teaching new counselors a foundational set of 24 skills. These skills can be implemented in a flexible manner based on the needs of individual clients. And KST teaches cognitive, emotion-focused behavioral strategies and a method for choosing where to focus first. So let's provide some definitions. What are thoughts, feelings, and actions? So thoughts or beliefs are cognitive processes that help people perceive, interpret, and assign meaning. So it's things that are going on in your mind as you perceive, interpret, and understand the world from a cognitive process. So feelings or emotions are affective responses that may be associated with physical sensations. So when we respond emotionally, we might feel a heavy heart or something in the gut of our, a feeling in our gut. But emotions are, products of the brain, just like cognitions. But there's often a physical sensation and it's often helpful to look at clients' physical sensations to help them identify feelings or emotions. So the third part is action. So actions are observable behaviors that involve the brain's control over motor activity. So thoughts and feelings are happening in the brain, even though there may be physical sensations, but actions become observable. And so it's something that you say and something you do. Although, it may be helpful to know that sometimes the action is I was frozen with fear, or I was paralyzed, or I was stuck. So non-action sometimes is an action. And it may be helpful to admit that thoughts and feelings in your brain may not know the difference between thoughts and feelings. So some psychologists talk about cognitive affective schemes, but for heuristic purposes, for instructional purpose, we're going to pull thoughts and feelings apart a little bit and think of them as two different things that interact tightly. So we're going to be taught a fundamental idea in KST is that thoughts, feelings, and actions can be adaptive or maladaptive, and also they're highly interactive. So this figure shows the way that maladaptive thoughts, actions, and feelings are highly interactive. So dysfunctional thoughts interact with maladaptive feelings that also interact with ineffective actions. And in this figure, it's important to note that all three of these arrows are bidirectional. Cognitive therapy likes to suggest that thoughts create feelings and actions, and those arrows are easier to observe, but there's plenty of evidence there are times when feelings come before thoughts, or that if we do certain actions, that's going to impact feelings and thoughts. So it's important to think of these arrows, all of these arrows, as bidirectional, and that thoughts, actions, and feelings are highly interactive. So maladaptive interactions are often the ones that bring clients to psychotherapy. It's often helpful at the beginning, working with a new client, to identify a maladaptive pattern, and look at the way that thoughts, feelings, and actions interact. So, for example, maladaptive feelings like hopelessness are often associated with dysfunctional thoughts like I'm a loser, no one would want to date me, and ineffective actions like social isolation and withdrawal. So this is more a kind of a depression, social isolation example, but it's true for any problem. So with anxiety, maladaptive feelings like fear are often associated with dysfunctional thoughts like the world's a dangerous place, and ineffective actions like avoidance. So we can describe almost any psychological problem as an interaction between dysfunctional thoughts, maladaptive feelings, and ineffective actions. And that's what we'll be talking about in lesson 8, doing a multidimensional survey, describing the client's presenting concern as an interaction of thoughts, feelings, and actions. So we've talked about how maladaptive interactions. Let's talk about adaptive interactions. And this is sometimes the way where we want to get in psychotherapy. So we want to encourage clients to embrace adaptive feelings like hope and a desire to overcome loneliness. And these adaptive feelings may be associated with functional thoughts like maybe I'll meet someone nice at the party, and then effective actions associated with overcoming fear and talking to new people in a social setting. So that's kind of a foundational idea in key strategies training, that thoughts, feelings, and actions can be maladaptive or adaptive, and that our job as psychotherapists, as counselors, is to look at maladaptive interactions and to explore and change in order to encourage more adaptive patterns that include adaptive feelings, functional thoughts, and effective actions. So one of the premises here, again, is that we're going to be working interactively between thoughts, feelings, and actions. So a counselor can work interactively to promote multidimensional adaptation and change. So different points of clinical leverage can be used with different clients or in response to different situations with the same client. So clinical leverage is an interesting idea. What I'm suggesting there is that we can, if we try and change thoughts, that will have an impact on that. When we leverage thoughts, that might have an impact on feelings and actions. If we leverage emotions, that can have an impact on the other two dimensions. If we encourage behavioral change, that's going to have an impact on the other dimensions. So this method encourages you, in most cases, to work interactively and have 3 points of clinical leverage rather than always relying on the same point of clinical leverage. So what are key strategies? Key strategies are skills or techniques that counselors use with clients to work toward therapeutic goals. We're going to be talking about strategy markers that indicate when a particular strategy may be useful. So as we go forward with the lessons, we have markers for when to use each of these strategies. We're also going to describe the expected consequences that describe the likely outcome of using a specific strategy. So we talked about that you may have already learned basic micro skills like open questioning, paraphrasing, and reflecting. I want to point out that key strategies are more complex combinations of basic micro skills. So when we explore a maladaptive cognition, we're doing that by using open questions, by reflecting, by paraphrasing, and so forth. So the title of this introductory lesson is Parallel Strategies for Exploration and Change. So there's 2 phases of treatment that we're going to describe. Exploration, which is understanding thoughts, feelings, or actions and the way they contribute to psychological distress. And then change, which is helping clients embrace more adaptive thoughts, feelings, or actions. So we're talking about the change phase. I'm also going to use the word transformation. So sometimes you'll hear me talk about the change phase, and sometimes you'll hear me talk about the transformation phase. The word change works a little better for thoughts and actions, and doesn't quite fit as well for emotions. So it's easier for us to think about changing actions, like I'm not going to watch TV before I do my homework. I'm going to watch television as a reward after I've done 2 hours of homework. That's behavioral change. Same thing with thoughts. It's easier to change your thought. Just saying, don't feel sad, feel angry, or don't feel ashamed, tap into your fear. That doesn't fit as well. So particularly when we're talking about emotion-focused therapy, we'll talk more about transformation of emotions rather than change. But we're still going to use two phases of treatment, exploration and change. So for each of these three theories, there are intervention processes for each of the phases. So we're going to outline 4 intervention processes for the exploration phase. So the first one is focusing on a specific dimension. Are we going to focus on thoughts? Are we going to focus on feelings? Are we going to focus on actions? The second intervention process is understanding the context and function. Where do these thoughts, feelings, or actions exist? And are they helpful? Do they serve a adaptive or maladaptive function? And how do they interact with other things? Then we're going to analyze their adaptive value. Are these helpful or not? And then we're going to discover patterns outside of awareness. So whenever a client comes into psychotherapy, they're going to be aware of some feelings, like I feel angry, but there may be underlying emotions. So when we talk about emotion-focused therapy, we'll talk about primary emotions and secondary emotions. And so discovering patterns of awareness may be looking at the core beliefs from a cognitive perspective, or the more primary emotions that may be underlying a secondary response. So those are the intervention processes for the exploration phase, focusing on a specific dimension, understanding the context and function, analyzing adaptive value, and discovering patterns outside of awareness. And over the next 6 lessons, we're going to apply these intervention processes to thoughts and feelings and actions. So we've said that there's also the second phase is the change or transformation phase, and that one also has intervention processes, 4 intervention processes. Experimenting is giving it just one word for one process is maybe misleading, because a lot of what we're doing with is experimenting. We are experimenting with new ways of thinking. We're experimenting with trying on different feelings. We're experimenting with possible ways to act that might change the way we feel or the way we interact with others. And so once we've experimented with something new, then we're going to say, we're going to try this out. And that's the modification, the modifying that. Once we've had some effective experimentation and modification, there's going to be generalizing and consolidating, and then finally assessing the change and impact. So those are the intervention processes for the change or transformation phase that we're going to be applying, again, the thoughts and actions and feelings. So let's talk about cognition strategies first. Cognitive psychotherapy focuses on thoughts and uses these cognitions as a point of clinical leverage to encourage multidimensional change. So the cognitive strategies encourage functional thoughts that are rational, evidence-based, and promote effective adaptation to the environment. So here's that same idea in a picture. Cognitive interventions are designed to have a primary impact on thoughts and a secondary impact on action. So we've got an arrow there on the cognitive strategies, and ideally when we work with clients using cognitive strategies, we're encouraging more functional thoughts, but that's going to have a secondary impact on adaptive feelings and effective actions. So we've got 4. So in the next lesson, we're going to be exploring 4 cognitive strategies for exploring thoughts. And I'm not going to read those all because we'll be focusing on them a lot more in the next lesson. But these are the 4 general processes that applied to thoughts or cognitions. So exploring thoughts is the topic of lesson 2. Then lesson 3 will be looking at changing thoughts with that experimentation, modification, and so on. So that's lesson 3, changing thoughts. So let's talk about emotion-focused strategies for a minute. Emotion-focused therapy uses feelings as a point of clinical leverage to encourage multidimensional change. EFT strategies encourage adaptive feelings, explore personal experiences, and promote awareness and growth. And then the outcome is adaptive feelings that help people evaluate situations, organize for effective action, and match situations in a proportional manner. So there's that picture again, switched around a little bit. Emotion-focused interventions are designed to have a primary impact on feelings and a secondary impact on thoughts and actions. So you've got that arrow from the experiential strategies to encourage adaptive feelings, but we're hoping that adaptive feelings will also generalize to functional thoughts and effective actions. But each of these different theories has a different point of clinical leverage. So when we get to lesson 4, we're going to be talking about exploring feelings, and we're going to have 4 different strategies that match those general processes, but applied to emotions, where there's focusing, understanding context, analyzing feelings, and discovering unexplored experiences. So that's lesson 4, exploring feelings. And then lesson 5 will focus on changing or transforming feelings. So there's that experimentation with new feelings, generating adaptive feelings, and then generalizing and consolidating those. So that's lesson 5, changing or transforming feelings. So then now let's talk a little bit about behavioral strategies. That's the 3rd package of strategies in our repertoire. So behavioral psychotherapy focuses on actions and uses these behaviors as a point of clinical leverage to encourage multidimensional change. Behavioral strategies support effective actions or reduce maladaptive conditioned responses. Effective actions help people meet their needs, attain their goals, or avoid undesirable consequences. So again, we've got the same idea here, but shifted around about clinical leverage. Behavioral interventions are designed to have a primary impact on actions and a secondary impact on thoughts and feelings. So same thing, we got the arrow of behavioral strategies has a primary impact on effective actions, but we're hoping that if clients engage in effective actions, that will generalize and support more functional thinking and more adaptive emotions. So on to strategies. So in lesson 6, we're going to be exploring actions using the 4 strategies that apply the general processes specifically to behavior. So focusing, understanding, analyzing, and then discovering patterns of reinforcement. So that's lesson 6. And then lesson 7 will be changing actions. So these are the 4 general change processes applied specifically to behaviors, where there's experimenting, improving skills, generalizing, and seeing if that's effective. So that's lesson 7, changing actions. And then once we've learned how to explore and change thoughts and feelings and actions, then we'll do the multidimensional survey in lesson 8. So I want to kind of wrap up with the idea of personal preferences. Most counselors or psychotherapists have a tendency to focus on one dimension more than others. And in the past, that was a part of choosing your theoretical orientation. Do you, as a counselor, prefer to focus on thoughts? Do you, as a counselor, are you drawn to actions? And so if you're personally drawn to actions, maybe you should be a behaviorist. Well, from an integrative point of view, we're going to acknowledge that most of us have a preference, but that may not be what we should always focus on. So I think it's important for you to reflect for a moment. Do you tend to focus more on clients' thoughts or feelings or actions? So think about that for a minute, and you might want to discuss that with a student, a fellow student, or a teacher, talking about your personal preference. And then it's important to figure out why. Some people just say, I'm a pretty cognitive person. I've always been analytic and thoughtful, That's just that. So it's important to identify your personal preferences and where they come from. It's also important to figure out which of these dimensions do you focus on the least? Which of these do you shy away from? And instead of always enacting your personal preferences, KISS, Key Strategies Training, is going to provide a method for exploring clients' needs and adapting interventions to the client rather than relying on the preferences of the psychotherapist. So instead of always following your preferences, we're going to encourage you to assess the preferences of the client and follow their needs rather than your own. And so I want to go back to the idea of psychotherapy integration. So this method, Key Strategies Training, will give you an introduction to cognitive, emotion-focused, and behavioral psychotherapy. Over time, you may want to learn about other theories that describe external contexts and internal influences that influence thoughts, feelings, and actions. So you may want to learn more about systemic psychotherapy and interpersonal psychotherapy and multicultural psychotherapy that focuses on external context. You also may want to learn about psychodynamic theories and biopsychosocial theories that focus on those internal influences. So Key Strategies Training is designed to be part as an introduction to a more complex training program called Training in Unified Psychotherapy, or TUP. So if hopefully in the future, you might, if you want more training, you might want to pursue Training in Unified Psychotherapy that builds on KIST and provides more comprehensive training. So that's what we've got for lesson 1. Lesson 2 is going to be on exploring thoughts and looking at those first 4 cognitive strategies. I hope you'll join us for the next lesson. Okay, Karunika, I'm going to stop. I'm going to end the. I'm going to end the. Oh, no, I didn't stop the recording. Oops.